The Kenya Constitution provides every person the right to the highest attainable standard of health, including the right to healthcare services and reproductive healthcare. A person won't be denied emergency medical treatment, and consumers have the right to the protection of their health. The government has the duty to protect and promote the right to health, take legislative and policy measures to realize economic and social rights, including health, place affirmative action programs to ensure minorities and marginalized have access to health services, and prioritize widest possible enjoyment of economic and social rights, including health, when allocating resources. The national government is responsible for referral health facilities, health policy, capacity building, and technical assistance to counties. County governments are responsible for county health services, including local health facilities, promoting primary health care, licensing food sellers, veterinary services, cemeteries, crematoria, and solid waste management. Apart from the Constitution, we have the Health Act 2017, the Kenya Health Policy 2014 to 2030, the Kenya Emergency Medical Care Policy 2020 to 2030, the National Reproductive Health Policy 2022, and the Kenya Vision 2030, among others. Kenya has ratified international and regional conventions that form part of its laws and create binding obligations on the state to give effect to the right to health. These include the Universal Declaration of Human Rights, International Covenant on Economic, Social, and Cultural Rights, Convention on the Elimination of All Forms of Discrimination Against Women, Convention on the Rights of the Child, Convention on the Rights of Persons with Disabilities, African Charter on Human and People's Rights, and African Charter on the Rights and Welfare of the Child. Despite putting in place numerous policies and legislative frameworks, several factors inhibit the enjoyment of the right to health in Kenya. Policy and legal obstacles. Lack of adequate legal and policy frameworks to meaningfully give effect to the constitutional right to health. Lack of policy guidelines on the progressive realization of the right to health. Lack of affirmative action and social health insurance to cushion vulnerable and marginalized groups from the risk of catastrophic expenditures. Lack of health financing policy and guidelines on budget allocation for implementing the right to health and health functions under the Constitution. Health financing obstacles. Frequent delays in the disbursement of equitable share and conditional grants by the National Treasury to county governments impedes health service delivery. Health system obstacles. Weak regulation and monitoring of private healthcare services. Lack of clear strategy for scaling up and sustainability of universal health coverage pilot program. Weak coordination and cooperation within the devolved health system between the national government and counties. Lack of a policy on implementing and managing concurrent health functions between the national government and counties. Lack of formal recognition and integration of the community health system as a critical part of the health system. Health system preparedness and response to health emergencies are inadequate. Health workforce obstacles. Inadequate health information management system. Inadequate healthcare workforce. Lack of recognition and remuneration of community health volunteers as a critical part of the primary healthcare workforce. As a commission of jurists, we call upon policymakers and legislators to improve legislative and policy reforms and interventions that enable the full enjoyment of the right to health. Improve access to quality healthcare services through capacity development and technical assistance to county governments, promotion of inclusivity in service delivery at all levels, and instituting regulatory mechanisms that promote the quality of healthcare services. Strengthen the health system and institutional environment to realize the right to health. Protect and promote human rights, specifically the right to health during health emergencies and humanitarian situations. Enhance public participation and awareness on the right to health through deliberate programs and initiatives in conjunction with civil society actors. Ensure sustainable health sector financing through regulation, advocacy, costing of health functions, donor coordination, and other policy and legal measures for sustainable healthcare delivery. We urge policymakers and legislators to improve legislative and policy reforms that enhance the right to health as enshrined in the Constitution of Kenya, regional and international legal instruments.